Good morning. It's just after 7:30 in the morning, and it's time for coffee, buses, and politics. I'm David. I'm joined by Stephen, Martin, and Alex. Um, how's everybody doing?
Yeah, well, you know how I'm doing, dude.
Yeah,
Yeah, it's been a tough week for me. I lost my dad a few days back, which is very sad. But it was sort of been coming, to be honest. And my dad was quite old, so it's where it is. But we're dealing with that as a family at the moment. Um, but yeah, it's been rough. But um, worth saying, treatment my dad had was absolutely fantastic.
good. I think all of our condolences, and if I can, on behalf of the uh, coffee, buses, and politics viewers, just say how sorry we are. I know he was older, but it was incredibly hard. And yeah, our condolences to you and to your family.
Yeah, I'll just sorry, I don't want to, but I think because I think we've agreed we're going to talk about the NHS first thing.
Yeah.
We've talked about the new Labour government a number of times talking about the NHS being in crisis, and I sort of agree with that at a national level and at a systemic level. I think the NHS has got huge problems, but the point I would start with, and you hear this a lot from others as well, is the care that my dad had right from the point when my mum called an ambulance. And the ambulance was there within 20 minutes and spent a long time, in fact, 2 ambulances at one time looking after my dad, right up to, the point at which he passed away. They were amazing. And some of the people there, the ward that he was on, A4, the nurses were amazing, just so caring, because we knew from very early on that my dad was going to he was going to die, so they put him on a palliative care package. And the point we were stressing all the time was make him comfortable, no pain. And the palliative care nurses and the palliative care team, how anyone could do that job.
Very difficult.
They were absolutely stunning, and I just Peterborough City Hospital deserve all the compliments for the way they looked after my dad. And we should remember that in the middle of all the comments we get at a national and a political level, there are some really fantastic, dedicated professionals in the NHS, and they were absolutely amazing.
Yeah, I think that's really important thing to remember, because I think everyone who, and most of us have used the NHS, at least one time, if not several times in our lives. And I think, it's quite frustrating, from a personal perspective, when you're like, waiting too long, or you're on those like multiple year waiting lists, and you think like the whole system is broken. But like once you actually get there and get your appointment, you think like, well, I'm really privileged to have access to this in this country, because so many people across the world don't have free NHS at the point of use. And that's something that we manage over the many decades to still preserve, which I think it's really amazing, even if you look at other countries, how this doesn't really exist, or how healthcare in some countries is nowhere near what we're getting in the UK. So I think it's very easy to be, as well as like politicians locally or nationally, to be critical. And I think we should obviously try to improve, but we often forget about what actually does work, and how lucky we are as individuals living in a society that we actually have this. Because if we were in other countries, wouldn't have this at all.
Yeah. I agree with that. I mean, we do need change, and it's I know this is a local show, and it needs national change, but part of what it needs is to make the NHS a bit more local in some places. And one of the things I fear a little bit is, just as an example, one of the things we know that needs reforming, and nobody ever does it, and it's needed reform for a couple of decades, is adult social care. And it needs bringing into into the NHS picture, because these things like bed blocking and all these things, if you've got an integrated system, they become irrelevant, and we need to do that. But one of the concerns is throwing that in the midst of everything else in the NHS and just bringing it in without actually reforming social care would be a mistake, because we've got to think about the whole caboodle, not just to say let's take adult social care, let's throw it into the NHS and that's the job done, because it's not.
Absolutely. I mean, there's the other thing, of course, there's the issue that, both adult social care and the NHS are struggling, and obviously reform of any type is difficult. It takes time, it takes resources away from other things. Just the process of change can make things really quite, just adds to workloads. And this is one of the things about I've talked about local government. We've talked about local government reform. It's that it's also expensive and takes time and effort and so on. But I wonder if part of it as well is the NHS itself is too big, and it's such a it's the turning a battleship round or turning an oil tanker round.
Do you mean in terms of like the different layers of bureaucracy or management, or just covering too many things?
No. I meant so. Well, actually, I mean, I think I meant two things. One is the levels of bureaucracy, which I see a little bit. My other half works the NHS, but also whether having, because effectively we've got 4 NHSs, one for each of the home nations, and is they're if you think maybe there's I don't know, this would add to the bureaucracy, but it just seems there's an awful lot of administration that goes on. But yeah.
I personally would, if it was up to me, I'm an advocate of regional government as a way of enabling devolution. I think a sensible thing would be to mirror, and there's an argument, because the NHS and the arguments that are made about how good the NHS is or isn't in Wales, that suggests not to do this. But I still think the idea of bringing it into regional government structure so that it becomes accountable to each regional government would be a good thing, because all of the NHSs have got areas of and hospitals that have got regional expertise anyway, and to deal most illnesses. But it also allows a little bit of innovation as well, and enable innovation, so that you can effectively take something and apply it in one area, a new thing, test it and work it, and for the other areas to learn from it. That's something that local government doesn't do enough, but the NHS doesn't really in the same way have the ability to do it. And to me, that part of our system has to be about how do we encourage innovation in public services, and the way local government is beholden to government for funding means that they can't do it, and the NHS structurally has to be able to do it. And I also agree and think that postcode lotteries are not necessarily a bad thing. The phrase postcode lottery doesn't help it, but the idea that you can the idea that you can tailor services better on a regional system to the people that live in that region, I think is a good thing.
I mean, I think the example on that I've sort of mentioned before, in Spain, healthcare is delivered by the autonomous communities. Mm-hmm. And I mean, I said my encounters with the Spanish health system, I've been quite impressed. But I think there's one thing is how you, and people have got more experience of budgets. Martin, I think this may particularly, because you've got the longest career in local government. You've got an issue sometimes where it may be cheaper to do. I'm trying to think of a good example. It might actually save money on the health budget or the social care budget to run a particular bus, say, but because the healthcare budget is a national budget and sits over there, or it sits with whoever it is, and the buses are done by local councils, it is a different budget. you end up not doing something because it's whose budget it comes out of. I'm not sure how well I've explained that example, but whether sort of sending social care up to regions and healthcare down to regions would actually mean there's more of an an incentive to deal with those issues together because they are related.
Well, I think in general, even like nationally, just government departments need to be working better together. Like especially in terms of like this area of prevention, I think it's quite frustrating when, for example, you can't really link, let's say, transport decisions with health in the same way that you would like to do. Indeed, like, of course, the county council has a public health function, but like the budget you have there is probably not what is needed. Like really, if you want to do like proper prevention, if you think about, let's say, even a simple example of like, stopping smoking interventions and how that often has like kind of a public health budget and the more like educational side, but it also has the implications in GP practices, because if you want to go to stop smoking services, you have to get those appointments, which often are not, we have seen during COVID, but also like after, those kind of more preventative things are not really prioritized when you have like urgent things to deal with, like during the pandemic, like even after when the NHS and GP surgeries really struggled. So I think actually looking at prevention as a bit more collaborative budgeting and a bit outside this day-to-day activity is really important, because otherwise you always put it off saying like, well, why should we prioritize those whatever area of prevention appointments when we have like such a long waiting list to deal with urgently, and we have like critical people in critical condition.
Yeah.
But that's the problem with the NHS, isn't it? Is that compared to other similar countries, we spend a lot more in hospital care, and our critical care is generally great, as Martin has experienced, unfortunately, this week. But our primary care is really poor compared to other countries, which is what stacks up problems. We don't detect problems early enough. We don't treat them early enough, and that ends up costing much more money downstream and having more negative outcomes as well, which is even worse. Like if you can catch people at stage 1 cancer, it's relatively easy and cheap to treat. If it gets to stage 4, then things are more expensive and much more difficult for everybody, and we do a really poor job of that. And so we need to try and somehow put more resources into our primary care, where we struggle to recruit and maintain and hold on to doctors. I think that's one of the core problems in all of this.
I said when I was cabinet member for adult social care and adult services at Cambridgeshire, one of the things I used to say is that we don't have a national health service, we have a national treatment service, and it's a different thing. And so I think that sort of is agree with what you're saying, Stephen, and absolutely right that it's at the front end that we need to be at our best with the NHS, and the NHS needs to be at its best. And I think that's the bit that's struggling the most.
Yeah,
when I talk to my colleagues in other countries, I've got a lot of Belgian colleagues and a lot of German colleagues and all French colleagues. Their access to healthcare is much better than ours. It's a struggle to get a doctor's appointment right now, post-pandemic, and there's no continuity of care either. So I haven't seen the same GP twice, for the last 10 years, because it's always a different locum, and that's difficult as well, because there's no kind of understanding of your health condition, and you feel like you're going back. I've got sports-related injuries to my knees, which I can never get fixed, because having to go back and beg to get an MRI time after time is difficult, and that's part of the problem. I think if we had better access to care, we would solve more problems up front, and it's just something we can't do at all at the moment. I tend not to go to doctors anymore because the hassle of getting an appointment is too much.
I wonder what things could be done. What could be done to actually reduce some of the pressure on GP services? I was thinking about actually prescriptions and how prescriptions work in this, in the UK as compared to other countries. And for example, could we use more community pharmacy services for some of the things that are now done in the GP practices, and actually have more time for other things to perhaps speed up referrals, or I don't know what you think about it. What actually can be done pragmatically to reduce some of the the time on the long waiting list of appointments in some practices?
One of the things for me is about trying to find ways for GP practices to do more, to do preventative health. Because I think if you can get preventative health right, you know, and you know, the scans and those sort of things, we know that, you know, as an example, breast cancer screening picks up cases of breast cancer, you know, and it helps to pick it up early. And the more you can do that, the more that primary care, the less primary care becomes reactive. And you know, that allows you to then focus on, you know, the things like, you know, the health messaging and you know, allowing, you know, primary care to do some of this public health stuff at a local level, because then they can address immediate local issues and local trends as well. And that's the bit for me, is to try and make it less reactive, less of a system where it is you know, the primary aim is to deal with patients who have issues. It's not to say they shouldn't do that, but to have a system where what you're doing is detecting and dealing with those issues early, so that people aren't having to make these reactive calls to GP surgeries all the time. That's it to me. I mean, that's probably a delicate balance to get right, but that's what seems right to me.
I mean, I do wonder if there's other things that could be done. I mean, I'm thinking around sort of referrals and so on, that you know, that, and I think it's probably a delicate balance, but as is everything, if you want to see a specialist, you're you know, the GPs are the gatekeepers of the system. There's very good reasons for that, and mostly it does work well. But there are times, and this is something I've had, where, you know, ongoing health issue, I've seen a specialist, the specialist has sorted things out, I've been discharged by the specialist, and then a period of time later that changes, and I need to go and get a change in medication or whatever, and it's one where the it's going to need to go back to the specialist to psych to deal with, and there's various other things like that, and I wonder if there's scope for more direct referral or whatever to specialists, to consultants and so on. I mean, it's difficult as well though, because people, you know, you think, oh, I'll refer myself to the specialist, but then, you know, we're not doctors, we don't know the way of you know what something is, and there are lots of things where you think, oh, it's a symptom of this, and actually it's not that at all. Yeah, I wonder that. I mean, I think possibly part of the issue as well at the moment is just resourcing, and I mean, I do think the NHS is kind of bureaucratic, and I think that is you know, and I know it's easy to say, oh, we should cut the bureaucracy, and you know, it's an easy thing to say, but actually rather a harder thing to do.
I absolutely agree with that. I you know, and it is. So I go back to my days when I worked for the MOD, and you know, I worked at Brampton and Whitton, and we went through the phase, you know, after the end of the Cold War, where, you know, the defence budget was being cut, and, you know, for valid reasons, because, you know, we didn't have the major threat to peace that, you know, we were dealing with. And they went through a thing called Frontline First, and a process called Frontline First. And what Frontline First was them saying, how can we protect the front line of the Ministry of Britain's defence, but at the same time maintain that, and effectively cut back on bureaucracy. What can we do at the back end to make things more efficient and everything else? So, and it's the point for me is that's what the NHS needs to do. And part of the Frontline First policy was to go out to every single staff member and give them a route to make suggestions about what they would like to see changed and stuff like that. What they said was, there are no sacred cows, was one of the phrases they used. In that, you know, if you make a suggestion, it will be considered. You know, and some of the stuff went in there. As an example, I remember somebody suggesting that they should get rid of the red arrows. which they did, but they did consider it because the red arrows is obviously costly, but it isn't something that helps the front line. You could argue that what it does in terms of pilot skills and stuff is fantastic, but it was much, as a public facing thing. And that sort of process where you can get out to people and the people that work at the front line, people that work at the coalface, and say, what's the bureaucracy you're facing? How do you think we can deal with it? What are the things you would like to see deal with? And let the staff do it. And then if you did that, okay, then link that to pay. So you start to say, these are the things we need to improve. If we can make this more productive so it costs us less to run, it allows us to do two things. It allows us to put more into the front line of the NHS, but at the same time, we can use some of the savings to put into pay increases and salary. And it's that sort of thinking that we need. When Stephen Barclay was Health Secretary, I threw this idea at him because he was obviously my MP as well. But I'm not convinced he listened, and whether he should or not, I don't know. But I do think it's that sort of thinking that we need, because the NHS is bureaucratic by the nature of the size of it and what it does. Yeah. It's hugely bureaucratic, and we've got to work out what's good bureaucracy and bad bureaucracy.
Yeah, and the thing it's always very easy to say, oh, we should cut bureaucracy. One of the things that we saw this with COVID is you do need some slack in the system. You do need, spare capacity for when things, for the unexpected. And they're actually having really good administrators around who could go, okay, this is how we deal with things.
I wonder also sorry, David.
No, go ahead. I wasn't explaining myself very well.
I thought as well about the use of technology. I think, like we mentioned a bit earlier. Like I'll be actually curious to see how we compare with similar economies and countries in terms of the use of technology within healthcare. And I'm not an expert on this topic, but for example, if you look at prevention of death from cancer and getting to a diagnosis early, actually the type of scanners that you use and how good they are, and how some up-to-date technologies can really help with that, in addition to getting through the appointments in terms of prevention. So that's one of the things I'll be interested in, is like, if we actually invest more in innovation and science, can we come up with better technology that will then help this prevention duty that we have in general? I'm not sure like how maybe the UK is one of the best in this, but I do remember, for example, in the late 90s, when some friends who were coming from Romania to the NHS to work here and to learn from the technology and to go back to Romania to tell the others about the brilliant technology here. And I think a lot of countries have moved on very fast compared to the UK in terms of the use of technology, whereas let's say 20-30 years ago it was like, well, the UK was really leading in the type of technology we were using back in the, let's say, 80s or 90s, but now it's not necessarily the case. I mean, this links to our usual transport conversation as well, looking at like, I don't know, trains or buses or like any kind of type of technology that's used currently, and how in the UK, in some areas, it does take a bit longer to implement innovation.
Yeah, I mean, I think it's safe to say that we are not as good as we could and should be about cancer outcomes. I've just pulled something up from The Guardian, and I've just pulled this up quite quickly. But if you look at what it says, out of 3 countries of comparable wealth and income levels, the UK ranks as low as 28th for 5-year survival of both stomach and lung cancer. I'm just going to check how old that article is. That's January this year. And so, you would think 6th largest economy in the world, we shouldn't be ranking 28th out of 33. No. And that says that we are getting something wrong. And I'm going to throw something out there that I think you guys as Labour supporters might come back to me and not like. But part of it for me is about how we view the NHS. My view is that the way we need to look at it is start from how do we create the best free at the point of delivery health service in the world, and you start from that basis. And I don't think you would start with the NHS, and I don't think you would start with us funding the NHS in the way that we do. The German system, as an example, where your healthcare is funded. You might know a bit more about this, Stephen, than I do, but the German healthcare system is funded partly by a contribution from employer and partly by a contribution to the employee, by the employee, and actually you can choose your healthcare provider. And the point about that, there may be an element, as an example, with GP services, where an element of competition around that would be good for us. You need to put some capacity in the system first to enable that. And we do need to think about how things are structured and funded. And it doesn't mean we need to slap up taxation. It might mean we have to change the way we tax. And it's different. It's not more tax. It's different tax that will enable us to fund it. And we have to think about those things. And the more we just say the NHS, and the less we think about those things, the worse we do to ourselves.
Yeah, I mean, there are problems that come along with the German system as well, and I mean, funding is a big thing. I mean, yes, I completely take the point about, different tax, but the funding matters. Just in absolute terms, does matter, and the I mean, I think again in Germany, it's organized to sort of, it's more sort of state organized. One of the things, I was on a trip to Germany a while ago, which I thought was very interesting, was I was in Wertheim, one of Huntingdon's twin towns, and we were sort of doing a tour of the town, and they showed us a new hospital that's being built, and it was basically a cottage hospital, a recuperation hospital and it was basically over the road from the existing hospital. They said, well, we needed a new hospital for the town, so we had a referendum, raised a tax, and built the hospital. And we did that 18 months ago, and now we're building it. And it's like, it's that. Now, there'll be other problems with the system. I'm not, pretending it's a panacea, but it's that sort of level of, the mayor said, well, this is Oberbürgermeister, so it's slightly different, and the whole way local government is set up is different. But they could go and do that and say we have this specific local need, let's fix it. I mean, there is an issue that sometimes the most efficient way of doing things isn't, people get an attachment to the local hospital. Now, I'm not saying this about any particular cases, but there are instances where actually it is more efficient to have one big tertiary centre, and healthcare outcomes are better, but everybody wants things to be delivered locally. And it's sometimes actually that's not the best way of doing it. And you're better off having the sort of, Tyrannosaurus Addenbrooks that can provide those specialized services.
Yeah, I agree. There's a comment come in from on there from Masir about my view not being feasible about healthcare being. We need a healthcare system that is efficient and free. I don't know if somebody can put that up. I can't, but I want to challenge it, because our healthcare is not free.
It's not free. It isn't free. What's a bloody
it's the right challenge to make. Let's be clear. It is the right challenge to make, but healthcare is not free. We pay for it. It's right that it needs to be efficient. It will never ever be free. The issue is how your taxation pays for it. Is the point. Money will always be somewhere a counterbalance in one way or another, and that's the point we have to something we have to stress. We pay for this through our taxation, and the question is whether our taxes are being used in the best possible way to deliver us the best possible health service.
I mean, it feels like you pay a fortune, especially if you end up paying if you earn more money for an NHS system which you can't actually access. That's my biggest problem with it, is that if I broke my arm today, yeah, I'd expect to spend the whole day waiting around getting, A&E and then getting it X-rayed. It's never going. It doesn't really work for lots of people, and it costs a fortune. And there's no way of opting out of it. You can talk about private healthcare, but you have to pay that on top of your national insurance and other taxation, and if you can't access it, then it's no good. And that's my problem with it. I mean, I completely agree that everybody should be able to access healthcare, but at the moment that's not even the case, I don't think, because lots of people don't, because it's too difficult to get appointments.
I mean, it's the difference between free and free at the point of view.
Entitled to dignity in healthcare as well. And that's really important. I've nothing but praise for the treatment that my dad got over the last few days. Absolutely nothing but admiration. But in that hospital, there were people being treated in corridors. We're walking past older people with relatives sat on a bed in a corridor, talking to them. That's not acceptable. It's absolutely not acceptable. The indignity of having all these people walking around while you're trying to care for and be there for your loved ones is just absolutely not acceptable, and we've got to find ways of dealing with it.
Yeah, but both my parents died on hospital wards. I'm sorry to talk about this mine today, but both my parents died on hospital wards with the curtain around them, both of whom were late diagnosed because they went to visit their GPs and didn't get the correct diagnosis and end up in hospital a few weeks later, dying on a ward with a curtain around them, with people suffering similar conditions with no privacy and no dignity. And that was really horrible. And in both cases, I think their lives could have been extended if when they'd gone to the doctors the first time, the GPs had realised what was wrong with them. And maybe those are extreme examples, but I think it happens again and again and again. And that whole point about dignity is really, really important, I think.
Yeah, and I agree. And even with my dad, the question you ask about the systemic stuff is my dad, the stuff my dad suffered from and eventually died from was a consequence of him having a AAA bypass 15 years ago. And there is a point about they know that this is a consequence of that. So then you start asking yourself a question about, if that's the case, should he have been regularly scanned to try and get to understand that this might be happening and for this to have been dealt with when he was a little less frail. And I'm not that's not a complaint about anybody, but it's a question I think the system has to ask, and ask itself. It's and those are things that we need to do, and the NHS needs to be challenged in that way. And I'm not convinced that the way the public debate has been around the NHS that we've been able to do that.
Yeah, I think in terms of debate as well, I would just like, politicians across local and national level to focus more on this topic of prevention, because if we look at the main causes of death in the UK, you can see how a lot of those themes linked to, for example, what we eat and how we eat, how early it's prevented, obviously smoking, pollution, our environment in general, a lot of things that we could perhaps change a bit or could invest to change a bit in our environment to make those things more, less likely to happen. But also I think one of the, under discussed topics is this link between mental health and physical health, and how often, because of the pressures and because it hasn't been prioritized as it should, in my opinion, if you go to, let's say, the GP, and let's say you have experience a mental health difficulty, but you're totally okay, I'm going to work every day or carrying on, it's this test of does it have an impact on your everyday activity? But because you have to go to work and pay your rent, you do. So it doesn't impact your everyday activity because you try very hard not to impact your activity. But then because it's left unreferred or because of the waiting lists are years, it actually can end up very easily, and it happens in so many cases, very sadly, impacting your physical health because the mental health challenge is not addressed early on, because it's not prioritized, because but you can still go to work, for example. I give an example linked to the experiences myself and some of my friends as well.
I'm going to be really controversial here, so it's fine, but there's a point. I don't disagree with about mental health. I think one of the things people forget about mental health is actually, we're nowhere near where we need to be in the way we treat mental health, and I don't deny or that at all. But actually, what we need to also remember is that mental health and the way we treat mental health has got better. We never even used to talk about it, and it was David Cameron that decided to prioritise mental health, and actually start to improve it. And as that process of improvement has happened, what it's also done is encouraged and made a debate around mental health happen that's made us realise how much better we need to be. And I think we need to understand that it has got better. We have invested in mental health, but what it's done is opened up to all of us about how much better it needs to be, and we need to keep challenging to make it better. And we need to start thinking about prevention in terms of mental health as well. It's worth saying, and I don't talk about this publicly a lot, but I have hypnotherapy treatment, and that's something I pay for myself. And it's all, about my, just making sure that I'm on top of my mental health. And it's something that I wouldn't go without now. And you sit there and think, are the people that would benefit from that, where we would really, really stop a crisis further down the road through doing that. And we need to think about those things.
Yeah, also it's about public health messages as well, and like how much I think at the individual level, the knowledge around mental health has really improved, with like obviously more access to resources and the debate being more open around it. But I also think that is it's also like difficult, because the more you actually speak about it, the more you are able, if I say I'm more informed, I might identify issues, and then you go to like access the system, and then like more people try to access it as a result of being more informed. So I think it's like a bit of a difficult one, because the more you invest in actually like public awareness of issues, then we can end up with more people actually wanting to check something, or just like do some tests or things like that at the very least, which means that you need more capacity in the system. But I think generally with some things it is really difficult, because often I think, again, it links to how we're able to inform the public in general. I think there's like limited awareness, and I think there's still research to be done in this space, like medically speaking, about how certain mental health issues can impact your physical health, and in what way, because I don't think like just looking at experiences around me, like people didn't realize until it was too late how it impacted, for example, other aspects of their lives. And I think that's not necessarily clear when you go in and something is like not that bad, and you think like, well, you just get more sleep, and like spend some more quality time with your family, and like go on a holiday, and then by the time that you are like a few months down the line, it's actually bad, and it impacts your physical health as well. So I'm not sure how we're able to actually communicate this from a public health.
So one of the things as local politicians that we don't talk about enough is that the district council spends quite a lot of money on enabling public health initiatives, which are entirely preventative. They're not something we get scored on. So, we end up saving the NHS and the government loads of money, but it's not one of the primary duties of district councils. So you look at HTC, I get the credit for starting Pocket Park Run 6 or 7 years ago. In fact, that was paid for by HTC, who found me as an event director. They paid £3,000 to start a park run, and since then 8,500 people have run 43,000 5Ks, which has helped and improved lots of people's physical health, lots of people's mental health. We subsidise the sports centres so that you can afford to go to the gym in Huntingdon if you want to, because you don't have to pay commercial rates. And those kind of things they do things like walking football. I went on a Nordic walking course once, and so in terms of like getting people out and active, has benefits for both their physical health and their mental health, but it's not something that we get any credit for, because we don't. It's not one of the metrics that district councils are measured on, but it's one of the things that a good district council will do, and one of the few ways actually, as a councillor, you have much influence at all over public health policy.
Yeah, and I think from the county perspective as well, I'm not sure like how, and I definitely wasn't aware before I was elected on the county council about, our public health team and budget. So for example, the initiatives on like, stopping smoking, like working with schools, like around like some preventative messaging as well, like, you know, other like types of programs like sexual health and so on. So I think I would say that like if I had a magic money tree, I would like make the budget bigger, like on this kind of preventative programs. But that they do exist, even like, you know, with the current content, they do exist. And I think they often, I'm not sure how many people know, because I definitely didn't before. It's like kind of, you know, it's run at the council level with our ICS and other partners.
Yeah, I remember sort of dealing with public health as a cabinet member. Again, was one of my cabinet responsibilities, only for a short time actually. But one of the things I remember is going and looking at the smoking prevention stuff that was going on in schools that public health were doing, and it was at the time where we were really making inroads in preventing young people from taking up smoking. And some of the stuff that went on in schools was fantastic. You know, it was, you know, and the theory behind it was that, you know, it was peer pressure that was making people start smoking at school level. And I think we all, but so why not change it and make peer pressure the reason why people don't smoke? So start talking about the fact that your mouth tastes funny if you smoke. Start talking about, you know, so it's, you know, that has an impact when you kiss. Start talking about things like, you know, your clothes smell when you smoke, and just, you know, making those things and talk things that appeal to and are important to teenagers. And this is some of the stuff they did, and it was all driven by young people in schools rather than bureaucrats, and it was really, really effective. And that's how we need to do, you know, some of that we need to be doing with public health. I think the stuff we do around prevention, I don't think is enough. And I you know, I have a big thing about education that, you know, we focus obsessively with our schools being exam factories. You know, and you know, the stuff you just talked about, Alex, about and Stephen, about park runs and things like that. You know, at a young age, we need to teach people to be in love with the outdoors, because there's so many health benefits with it, and that should be an integral part of our education system. And we absolutely don't do it enough, you know, because we're too busy sitting people in classrooms and obsessing with you know, how many we can get 9s to. Yeah.
No, that's really interesting with the curriculum in general, and how, like, looking at some other country system, how much more emphasis is put on, like, well, sports, for example, like as part of the curriculum, and how in some countries is even, like, you know, compulsory, or until like the very last year of school, like you have to do X number of hours doing like a certain activity. And and to what extent you can avoid it or not as well. But I think it's actually really important, because if you had like, well, like every week, you know, like from an early age, I have to like do this, and I actually find something that I enjoy, you can see how that can prevent a lot of things early on, because it's really important to actually start as a, you know, in school.
It doesn't necessarily have to be about sport though, and I think this is important. I do agree, you know, access to sport, and we need to make sure children access to sport and have an opportunity to try and experience sport. I absolutely agree, but there are always children that feel, for whatever reason, that they're not sports minded.
Yeah, like me, I was bad at every single thing.
You know, I enjoyed sport at school. I can't tell you I was ever fantastic at anything, but you know, I enjoyed it. But there's a thing about the outdoors, and you know, when I was in the army, one of the things we used to do was have sports afternoons every Wednesday afternoon. So every Wednesday afternoon, you used to have to go and play a sport, and sometimes some of that was competitive, some of it wasn't. I remember when I was at Kyneton, me and a guy, one of my colleagues, used to we used to go for a run to the local pub. But you know, you had to do sport. But if people aren't sports minded, why not use an opportunity like that to take them to the local nature reserve and get them to enjoy nature and see what they see, and enjoy what they're seeing there? Just do something different and get them thinking about how good the outdoors is for them. And we need to think more about that within schools, because that, as a preventative thing, could be, but if you get it right, could be huge.
Yeah, I think it's a nice way to frame it. It's about like the outdoors, or like, you know, physical activity in an outdoor space, because you're completely right. I think in a lot of like schools and, you know, for example, especially in the US system, like the focus on competition and competitive sport is great for some people who can discover their passion early and then like go quite far in some of those sports. But for example, I, you know, really draw my personal experience as someone who, you know, every week I had like an hour, or I think it was 2 hours in school where I had to do like, you know, certain sports. So you have to be like, well, volleyball or football or whatever it was. Not the best conditions in the state-run school where I went, but like, you know, you had like a, you know, some outdoor space in the school. But then you discover it, okay, I'm like, you know, worse than everyone else, like, or, you know, than most people, and you really get put off. And then in the winter, like in the cold months, you had to do some stuff indoors. But for example, it was only later on in life, after I kind of like motivating myself, that I really like, for example, swimming, or like going to nature reserves, or doing like mountain like hikes, or like doing a lot of outdoor things that involve physical effort, or like, I don't know, carrying all the things, like moving my house or things like lifting.
I was going to say, Alex, you spend quite a lot of time walking, carrying weights, and you slowly
carrying
distribute
like
those.
Exactly, carrying boxes of leaflets long distances and so on. But like, but I think that the nature is what actually like changed my mindset, because I wasn't like very, very active, and it was precisely because I thought like, well, I'm actually not good at any of those competitive sports. And then if you don't have the facilities, for example, I discovered like maybe at 17, 18 that I could be quite good swimming, but I didn't have a swimming pool obviously in school, so I couldn't discover that in school without being outside of the school environment. So that's something that we could focus more on, like outdoors in general and nature.
And there's things that go with that. Michelle, I wanted to I mean, a couple of things about not referring to. So I'll put Michelle's comment up if that's all right. Firstly, I mean, Martin was in the army, so it's it's relevant for his experience. But I don't think it is hermetically sealed away from the rest of society in time of peace. I don't think that's right.
No, it's absolutely not, and we absolutely have to learn lessons from everywhere. I learn lessons from my time as a cabinet member. I learn lessons from the work that I do now around public engagement, and I learn from the places I worked at, and the military is an important part. I grew up with the army. I've got experience of army schools and all sorts, and to say that's not relevant, it absolutely is. What you have to do is you can learn lessons from everywhere. So as an example, I talked about sports afternoons and sports afternoons within the military. It is absolutely right that you sit and look at that principle and think about how you can apply it elsewhere. And it's absolutely right that you do that. I worked as a civil servant for 14, 15 years. And most of that was working for the MOD. And it's absolutely right that you sit and look at those things and think about how they apply. And there are absolutely things that we can and should apply. I worked on one of the worst IT programs in the history of the world, I think. I think called LITS, which was supposed to be a big logistics system that ended up delivering half its functionality that was predicted. And I sort of have good ideas why that happened, and why shouldn't I use that as a lesson? I think it's absolutely right to do so, and I think we all do that, and that's why we go into politics, I think, and that's why we need more politicians with experience of the real world.
Yeah, I agree. I agree with you. I mean, the other thing is the army is an organization, and you get experience about how to run organizations in organizations. Now, yes, it's a particular one with a particular role that works a particular way. It's still people. It's
a relatively small organization compared to the NHS as well.
Well, that's true, but it's absolutely. I thought we might move on just at the end, if that's okay, to some bus related news.
Bus of the week. There's possibly 9 buses of the week. One is that Flixbus, which is usually how I seem to get around Europe when I'm on the continent,
are doing a bus from Cambridge to London, or coach from Cambridge to London, which isn't anything particularly exciting, except that it's electric. And I just saw that, and I thought it was quite interesting that, you know, there's now going to be a fully electric coach service from Cambridge to London. The other thing was the pricing, because obviously it's FlixBus, and so prices vary, but will start at £2.99, which is a lot cheaper than the train.
Oh wow, I wonder how that's possible.
Well, there won't be many.
Commercially.
No, they do sort of surge pricing things, and there will be some tickets
Yeah.
available. Most will be more than that, but it's like that's. But you know, even if it's £10, that's a lot cheaper than the train. But
Yeah.
It's interesting. This is a medium distance application for an electric drivetrain for a commercial vehicle.
So it's worth noting that FlixBus, is run in Cambridgeshire by one of our bus companies, Whippet, who've also done a great job investing in electric buses as well. So the U buses around Cambridge are all electric. And if you go and visit it, I've visited the Whippet depot, and they've got a great charging infrastructure there. And I guess this is off the same infrastructure that they've invested in some electric buses as well. So Whippet obviously sometimes gets a bad press because they took over loads of the Stagecoach services in a rush after Stagecoach withdrew, and had to buy, because the bus market isn't very liquid, they had to buy some second-hand buses, and second-hand buses aren't great, but they've done a great job of replacing lots of their buses, and lots of those U buses I've seen going around St Neots as well, you know, used for the 66 and the 15. Is it the 15 that goes to Camborne? So they're doing a great job locally of investing and using electric buses. And the fact they're electric is one thing, but also they're new buses as well, which means that they're a lot more reliable, and that will increase the reliability of the service. Well, hopefully, unless they're running out.
There's a reality about electric buses and electric cars and all that stuff, which people don't forget, which is in general, they are more reliable and cheaper to run as well, because, you've not got petrol that's going flash and bang in the middle of it.
And mechanically, they're a lot more simple as well, because they're just loaded batteries, rather than, if you look at an internal combustion engine, there's got about 40,000 moving parts in it, whereas an electric car bus has almost very, very few moving parts in it.
That's one of my favourite topics.
It's an interesting one. I was involved. One of the organisations I worked for when I left the MOD was the Institute of Logistics, and I was involved on the edges of the first hydrogen bus trials in the UK. And at one time, I thought that hydrogen buses and hydrogen technology was the thing that was going to replace the combustion engine. But it has a lot of the same functions as the petrol engine. It's quite clear that as we sort of improve battery technology, that batteries is going to be the way forward. And I think this is proving it.
Yeah. It depends how if you use hydrogen for fuel cells, then it's fine. If you look at the hydrogen engine, or even a fuel cell engine, the amount of engineering that goes into it, those are also quite complicated.
Absolutely,
for exactly the same reason. So that's why I think EVs are winning out.
Looking at it, so you can get. So this is just going on the website now. So you could get a bus at 1 o'clock from London Victoria to Cambridge Parkside with FlixBus Whippet, which would be an electric bus. Takes 2 hours 40 minutes and costs £8.99. That's okay. It is slower than the train.
Yeah,
but
3 times.
Yeah,
but the train can go to Parkside.
Yeah.
Well, no, exactly. But that's the thing. But it's quite a lot cheaper.
Yeah. Absolutely.
That's true. And also, it depends what you can do on the bus as well, because I find, for example, like on some of the buses, I can actually do my council email backlog more effectively than sitting on the floor on the Cambridge to London train.
So this is the thing on the train from Huntingdon into London on that. The thing that would improve that journey would be for me personally would be to improve line side mobile phone coverage.
Yep.
It's like, so if I could, reliably do my emails, I'm afraid I'm not as organized as Alex, who will download her emails and do
No,
that.
I just do editing and proofreading on the
Yeah.
train journey because it's offline.
Yeah.
I mean,
But-
I absolutely agree, David. I think the mobile phone thing, we need to get right in travel, and the fact that some of these buses actually offer Wi-Fi, is something else as well, and now we've got satellite technology to access the internet and things like that, and which I think is going to take off in the next couple of years in quite a serious way.
Yeah, I think so.
I think all those things, we need to start looking at the technology we use for buses and trains and think about how we improve it, because part of the point about travel is you need to be able to travel A, in comfort, but B, so you're able to carry on. If you're traveling into London for work, and you're traveling within work time, it's reasonable for your employer to expect you to be able to do a bit of work on the train.
Yeah, exactly. And the thing is, it's like, if I had the choice, like going to London, which would I prefer? 10 minutes off the journey or reliable internet all the way through? And it's a no-brainer. I'd rather have the reliable internet. It's exactly that you can realistically, okay, you're not going to be doing masses and masses of stuff, but you can still work effectively. You can still deal with emails. You can still do, write documents and whatever. But increasingly now, like for my work, everything is on Google, so it's Google everything. And so, you can work offline, but it's a lot easier.
It's also worth saying that the slow train into London, which is the one that stops at Huntingdon, they could do with a few tables in there as well. But
yeah,
I mean, if I'm thinking about this,
frustrating.
I'm thinking about this every single time on the morning commute, seeing everyone trying to put their laptop in creative positions, or getting annoyed about the phone not working or hotspots and so on. And most people on those morning commutes actually do try to do a little bit of work or admin, because if you think about how many people, I'll actually be interested to see if there's any research, I'm sure there is, about how many people spend, let's say, 3 or even more hours overall in a day on commute time, and how that time can be used more productively in general. It doesn't have to be doing more work on top of work. It can be you developing another skill or learning something or doing a hobby, because a lot of this commute time is completely unproductive and annoying time, when it doesn't have to be this way. It can be as a time used to develop something, whether it's continuing your emails, like David says, or learning a language, or doing anything that requires access to internet. And the fact that we have better Wi-Fi, better connection on some planes now than we have on the London connection trains is really, I hope it will improve soon.
You could just read a book like I used to when I used to commute in the pre-internet days. I mean, there are other ways, aren't there? I suppose if you spend a lot of time on the tube, then that's what you end up doing anyway, because there is no.
Yeah, the tube is the book only, because it's so busy.
Actually, you can get Wi-Fi on the tube as well.
Yeah.
Yeah.
So
when you get people in Teams meetings on the tube next as well, and so some of the tranquility.
Do you remember the Dom Jolly sketch with the big phone? Hello. Yeah. Anyway, the other thing to mention just briefly is the a while ago there was a lot of controversy about the increase in the mayoral precept for the Mayor of Cambridge and Peterborough. That's to fund improvements to the bus services. The first set of improvements are coming online. I think there's improvements to buses there's a few. Busway South and Trumpington, the 3133 for Whittlesea, the 904, which will actually be rather good for me. And as we know, that is the most important thing in UK public transport policy, is does it get me personally where I want to go? And is there room for me to carry my toy soldiers? Peterborough to Parnwell, that's the 4, Camborne to Cambridge, Linton to Addenbrooks, Amazon to Manor Drive, the 18, St Neots, Camborne, Cambridge, which is good. But it's also, you start to see some of the advantages of a sort of integrated system. The 904 is going to go from every 90 minutes to every half hour. You also have the AW1, which the 904 is Huntingdon, Alconbury, Weald, Sawtry, Peterborough, stopping at places on the way. You also have the 904 that goes from Huntingdon to Alconbury, Weald. So the AW1, they're going to sync those timetables up so that there's a bus every half hour from Alconbury, Weald to Huntingdon. It's like
Alex
that.
and I almost nearly died on a hot day walking from Alconbury Weald to Huntingdon because we couldn't get a bus. So that's very welcome, I think.
Yeah.
But I was just last year before getting a car because of the general election campaign. So like if it was last year, like, you know, otherwise I remember those times of after I moved to Huntingdon being like, well, I can't get to this 9 a.m. meeting in the county council without leaving at like 7:10 or whatever it is. And then like, well, having to be the first person using any of the offices in the county council due to the 904 bus. But I'm really, really glad it's improving, and I'm sure I will use it sometimes.
Yeah, well, that 3133 from Wiltsey, that's my bus of the week, by the way. I'm going for that. But we've been crying out for those buses to, you know, and for an evening bus service in Whittlesea for a long time, and that's going to run buses up until 11:30 at night. That's how bus services should work. And you know, I'm going to say this again, and it's a bit of a political point, but I make no bones about it. You know, during my election campaign, you know, one of the things I talked about was the fact that the mayoral precept is enabling us to think forwards and look at improvements in bus services for the first time in a generation. And you know, the Conservatives put leaflets through my door that told me Whittlesea wouldn't benefit from it. You know, and we're now looking at this, and something that the town council, to their credit, have really tried to make happen in the past, has been made to happen by the mayoral precept that they opposed. And I'm going to say that because I think it's really important that people understand that the reason this has happened. That mayoral precept thing is not an easy thing to do, but you can start to see physical hands-on benefits in it. And, you know, we can start looking forward to thinking about what's next. You know, how else can we improve it? And from an economic point of view, the better access you have to work and work opportunities, the better it is for your economy. And that's what a lot of these are enabling, is access to work.
Yeah, and studies as well. Like I think what we're seeing is the kind of hopefully the move towards a more integrated system, because, for example, looking at the 18 from St. Neots to Camborne to Cambridge, saying, well, it will improve the service to help more students get to and from local colleges, and actually aligning bus timetables with like college and school times. The amount of money we spend on home to school transport, and of course some of that is needed, but like where we can actually use those buses part of an integrated system to take young people to and from school, like the better it is. And at the moment in so many areas you have to rely on the home to school transport, which is a very ever growing budget in the county council, because a lot of our public transport is not integrated. Of course, you still need an element of that budget for people who have specific needs or need, like, for example, taxis to be transported to school, but not every single route is on the case that every single route has to be done this way. It can be done by buses, but they don't exist or they don't align with the school times.
But this is where the franchising consultation that the link's been put up for is really important, and people need to take part in that franchising consultation, whether you support franchising or oppose it. And I'm a big supporter. You need to take part in that consultation. And one of the things franchising will do, because it will put the public sector effectively in charge of routes and stuff like that, it will enable the public sector to make that integrated transport work. So, as a good example in Whittlesea, where, our bus station is about 300 yards out of the town centre, and there's no buses that actually run to the railway station. And it sort of doesn't make sense when it is actually a 300-yard round trip. With franchising, we could do that, and we could just say, this is the route that we're franchising out, who wants to bid for it? And so you can see there where the franchising will have benefits.
Yeah,
I'm in Brighton at the moment, and I sat in an Italian restaurant last night on Western Road, and I was staggered by the number of buses that went past. I grew up around here, and I don't think I passed my driving test to my early 20s because I didn't need to, because you get a bus anywhere. And there's something about, I guess it's something about seaside resorts. They tend to have better buses, maybe because it's footfall, maybe because they're a bit more two-dimensional when you're only basically going east or west, aren't you, and a little bit north. But you know, around here, and I think what I'm going to do this today or tomorrow is I was walking around town last night looking at the previous bus steps I used to take to go to school, because that was such a big part of my life, was getting the bus in and around Brighton as well. So I think I'm going to do some bus reminiscence later and take some.
Do you know? I'm sorry. I'm sorry to say this, but I'm getting old, right? And you know, that's probably easy to see, but I get my bus pass in a few months' time. And I have this little idea that I'm going to try and use my bus pass and see how far away I can get from Whittlesea in a day without paying for a bus.
If you want company, I'll come with you and do that.
No, live stream.
Do you know on Travelling Turtle, Politic Animal, Joe? There's a friend of mine who does these things like how far can you get from somewhere in 24 hours by public transport. You should do something like that. Because he's done some quite epic journeys of, like, you know, how far you can get in 24 hours by public transport.
Or you can do a 24-hour live stream commenting like on the bus about all sorts of topics. Like they do those like marathons of political commentary sometimes on some like campaigns I was following. So when it gets closer to local elections, you can do like a running commentary of every single topic. But
right, we're doing this, and we're gonna do something so I can put it on this podcast in one way or another. Right. We're doing this now.
Sounds good. I don't know if I think it feels like time to wrap up. So
yes, it's time for work soon.
Yeah, put up a question from Merchaya, because being so it's a booming experience. Let's do my favourite pub quiz question. What piece of equipment goes suck, squeeze, bang, blow? It is, of course, the internal combustion engine.
We used, because I worked for an engineering company, we used to have a T-shirt that had like either suck, squeeze, bang, or blow. And I sent my kids to PE lessons for it for many years, and I'm surprised I didn't get social services involved. But there was always an engineering, when you had blow on your T-shirt, it was always an engineering blow, not the other type.
Yeah.
What's the other type?
The wind, Martin, the wind.
Okay, that's fine.
Yeah. Well, have a lovely weekend, everybody. And I think it's the bank holiday on Monday, isn't it? So
yes.
enjoy the bank holiday. Yes, and we will be back same time next week.
Yeah. Can I just finish with just a final thank you again to everybody that looked after my dad, just as a final thank you.
Of course, yeah. And well, condolences to you and your family, and take care, everyone. Bye.
See you next week.